So far we entered the hospitalization information for this patient during the first treatment cycle of 10 days. And the great improvement in this new version of the app that now you can enter retreatment cycles. And you can enter as many retreatment cycles as you need. And here, for the purpose of the example, I'm gonna enter one more treatment cycle for this patient. So if we go to hospitalization now, the first cycle that appears as completed has all the data because, as I did in previous videos, I entered both the daily updates and the treatment information. So we are done. So now we're gonna start a new 10-day treatment cycle. So we press that big button, and that takes us to the forms to define this new cycle. So we will enroll this patient for the treatment cycle 2. We say yes. All right. So we click yes there, and we go to next. And then we say when this cycle started. So if we remember, this patient was admitted on January 21st of 2011. So the patient went a full treatment cycle of 10 days, which started on the day after the admission, on the 22nd. So we have 10 days. We have 10 days. So that means that the first cycle ended on February 1st. And so the second cycle, in this case, started the day after the first. So it will be February 2nd of 2011. That's all we need to define a new treatment or a retreatment cycle. So we finish after entering the date. And that's really all we need. Now that we will have is a second cycle whenever we go into the clinical features or treatment options under hospitalization. So let's take a look at what happened. Let's take a look at the clinical features. So if we go there, if we select clinical features, we have this form will allow you to record clinical features since the start of the current treatment cycle. So this now is entering the data for the second cycle, right? So this is important. See the patient that did not have bleeding, and in this case the patient was discharged after the third day. So we only need to enter the data for these 3 days the patient was at the ward. So the temperature of the patient in these 3 days, 37, 37.5, 37. Maximum systolic blood pressure, 120, 110, 110. And then diastolic blood pressure, 80, 90, 90. Maximum pulse rate, 80, 85, 80. Maximum respiratory rate, 25, 26, 24. And there are no clinical features to report, and no additional clinical features, and no complications. So we are done entering this. So now let's complete the treatment data for the second cycle, go into hospitalization, and here you can see that because we are going back into hospitalization, we have the two cycles that we can edit. The first cycle that started on January 22nd of 2011, and the second cycle that started on February 2nd of 2011. So we will select the second cycle, so the retreatment. So I'm gonna select that, and that takes us to this confirmation page. This is a cycle that we want. If we realize that this is incorrect, we can simply go back and select again, but this is correct. And we go ahead, and same as before, now we have clinical features, which we already completed. And all we need to do is to enter any information regarding the hospitalization. And in this case, the patient did not receive any antibiotics, no antibiotics, no analgesics, and no other medications. Essentially, we're done. And this takes us back to the hospitalization. But as you could see, we were able to enter a second treatment cycle by first creating a new cycle and setting what was the starting date for that cycle.